Good afternoon. Welcome to the Screenside chat on school and COVID and issues like that. I'm going to wait about a minute and let attendees join the conference. People are coming in from the waiting room now. So get yourself settled in. We've got a great afternoon chat here with Crystal and Anastasia, and I'll do a little bit more of an intro and let them talk about themselves in a minute or so. We'll let everyone pop in. Just so you know, this is a webinar format. So please open the chat window and the Q&A window. If you have questions, which we would like you to share, you can put those in either the chat area or the Q&A area, and we'll make sure that Crystal and Anastasia have a chance to answer those questions. All right, so we're a couple minutes after 3. We might as well get started. Welcome again to the Children with Diabetes Screenside chat. Today we have Crystal Woodward and Anastasia Albanese-O'Neill, both deeply involved in safe at school issues. Crystal has been known for years as the driving force behind the ADA's Safe at School program, and Anastasia is the co-chair for the ADA's Safe at School working group. And what I'd like to do is ask both of them to introduce themselves, and then we'll get going. And again, this is a Q&A driven webinar, so please share your questions in the chat or the Q&A, and I have some good ones in case you don't have anything good at the moment. All right, Crystal, why don't we start with you?
Sure. Thanks so much, Jeff. Thanks for inviting Anastasia and me this afternoon to share. I'm Crystal Woodward. I'm the National Director of the American Diabetes Association Safe at School Initiative based out of its national headquarters in Arlington, Virginia. I am also a T1D parent. I have a daughter who was diagnosed at the tender age of 17 months, and she's now 30 years old, an ICU nurse, and just thriving. A little bit about Safe at School. Safe at School, what we do is we take the legal protections of federal and state law to make sure our children receive appropriate accommodations at school. In other words, to make sure they're not discriminated against because of their diabetes, and to make sure they get the care, support, management that they need in order to be successful and in order to thrive. So looking forward to hearing your questions this afternoon. I know this is a high anxiety time anyway, and then this year we have the added twist of COVID-19. And before I forget, I just wanted to share an example of what we've been hearing from parents. I received a question recently from a parent who asked if in a situation where masks or facial coverings were mandated, would the child be able to remove the mask without penalty to treat a low? And of course, the answer to that is yes. But I just wanted to give you a flavor for some of the questions we're getting and the concerns of parents out there. So thanks for being here.
Thanks, Crystal. Anastasia, your turn.
Yeah, thanks so much, Jeff. Great to be here this Sunday afternoon. Thank you, everybody, for joining. My name is Anastasia Albanese-O'Neill. I'm a faculty member in the Department of Pediatrics at the University of Florida. I'm also direct our diabetes education and clinical operations in pediatric diabetes at UF, and I'm a nurse practitioner and diabetes educator. So I work in clinic with families of children with diabetes. I have a child of my own with type 1 diabetes. She was diagnosed 18 years ago at the age of 16 months. Crystal and I share that experience. She is now a college student, and she moved into her dorm yesterday. I do a lot of research in diabetes technology. It's funded by the National Institutes of Health and the Helmsley Charitable Trust. So automated insulin delivery systems, continuous glucose monitors, and artificial intelligence algorithms are some of the studies we're working on here. But I am very passionate about diabetes in the schools and keeping children safe. I'm going to stop there because our goal is to answer your questions. And please enter them into the chat or into the Q&A so we can really address any concerns you have, because these are definitely unprecedented and very strange times.
All right, well, we don't have any questions yet. So what I'm going to do is tee up a couple that I think everyone's interested in. So for Anastasia, given your medical and science background, does having type 1 or type 2 increase a student's risk of exposure or infection to COVID-19?
Thanks, Jeff. That's a really important question. And so when we talk about exposure, exposure means, am I going to be exposed to the virus? Am I going to run into somebody else with the virus? And so that really depends on where you are. So I'm here in the state of Florida. We've made the news a lot recently in terms of our community spread. Things are improving slightly, but we've had very high rates of the virus here. So people here, every person here has a higher risk of exposure to the virus, and that includes people with type 1 diabetes and type 2 diabetes. If you're a healthcare worker, then your family probably has a higher risk of exposure, or if you're in some kind of close contact with somebody with COVID. Now, are you at higher risk of getting it? No. So particularly, I want to address type 1 diabetes. There has been a lot of confusion in the media about autoimmune, which we know type 1 diabetes is an autoimmune condition in which the body's immune system makes a mistake and destroys the insulin producing cells in the pancreas. This is different than being immunocompromised. That would be somebody perhaps who is undergoing treatment for cancer and whose immune system is unable to respond in the usual way to an invader like a virus. So autoimmune is not equal to immunocompromised, and so that doesn't mean that you're at higher risk to getting COVID or the coronavirus if you're exposed to it. Now, in terms of severe or the pathway, once you've been exposed and you've gotten the virus, if you look at the Centers for Disease Control and Prevention, they've actually listed type 2 diabetes as a higher risk for severe disease course with COVID compared with type 1 diabetes, which is in a slightly lower risk category. I hope that answers your question, Jeff.
It does, and it's a great explanation, and I know that families are very concerned about kids with type 1. What does it mean? Should they get out? All right, so Crystal, because I'm still waiting for questions. We've got a comment, which I'll get to. So what is the first step for a family in preparing their child for a return to school this year?
Yes. Well, the first step really this year and every year is for the child to get their diabetes medical management plan in order. And what that is provider's orders that have been written by the provider and discussed with the parent. And it's essentially the prescription for diabetes management that's going to be implemented in the school setting. So once we have that DMMP or diabetes medical management plan, the parent should communicate with the school nurse, and that could be via Zoom, it could be in person, but regardless of whether or not the child is doing in-person learning or virtual learning, there needs to be a DMMP. So once we get that in order and get it submitted and have a meeting with the nurse, the next step would be for the family to update or to develop, if it's a new diagnosis, a Section 504 plan or other written accommodations plan. And what that plan is, it's a legal document that sets out the responsibilities of all the stakeholders, the schools, the parents, the student, who's going to be trained at school, will the student be permitted to self-manage. It addresses academic accommodations, such as the child having the ability to take an exam at an alternate time if blood glucose levels are out of target range. So that would be the second step. So regardless of whether or not, again, I'm going to say it, whether or not it's your child is in the in-person learning mode, hybrid learning mode, or the virtual learning mode, the ADA strongly recommends the DMMP and the development or updating of the 504 plan. Those are the first steps.
Excellent. So we have a kind of a comment question, I think, from Sarah, and I'll read this for everyone in case they didn't see it. She says, so glad we're putting this on. They chose virtual option for her son and was told he could not participate in band again this year because the Florida virtual school did not offer band. So they were not obligated to offer band to virtual students. They chose to make a special accommodation but said it was more of a favor when I inquired about equal access to extracurricular activities. So this does bring up a question about extracurricular activities for families whose children are doing virtual school rather than in person. Is there any guidance or advice on 504s or IEPs or things to make sure that kids who stay home for whatever reason don't miss out on those important aspects of school?
Well, certainly, no matter which option is chosen for the student should have equal access and participation without any penalty to school-sponsored activities, whether it's band or the varsity football team. And I'll go one further. Not only should the student, regardless of the learning mode, have equal access, but the school is still obligated to provide needed care to that student in accordance with the student's diabetes medical management plan. So I strongly suggest that when parents are negotiating those 504 written accommodations plans this fall, to make sure you do address extracurricular activities, no matter the learning mode. Yeah. It shouldn't matter. And let me just say that students with diabetes have the same legal protections during a global pandemic. It doesn't change. There are additional provisions we'll want to write into the 504 plan, which I'm sure I will have an opportunity to talk about in a bit, but those obligations don't change. I mean, the only thing that will change is for a virtual student, obviously you're not going to have a school nurse who is providing physical care or a trained teacher staff member who's providing physical diabetes care to that child. But even so, the school nurse, if the family chooses, does do telehealth visits, frequent or infrequent telehealth visits, and that school nurse can still help the family, if needed, to find those resources in the community to help take care of that child in terms of diabetes management.
Yeah. Jeff, could I just add, because I see this question comes from Florida, and I think this is a point of confusion for families. And so a couple of things. School districts, as you know, there's a mandatory back to school order in Florida. All schools have to open in some capacity. Some offered an online or e-academy option, which was virtual learning managed by that particular school or district. But the state of Florida also has a virtual learning school, which actually, when you move your child into virtual learning, they're actually in a different district. And so I think a key here is to this parent who asked this question, ask a lot of questions in advance. I am glad that your local school accommodated your child when they moved into that virtual school district, but these are questions parents have to ask. There's so much uncertainty out there right now. When we talk about online learning in Florida, that could mean a lot of different things. And so this is really essential that you ask a lot of questions. A lot of parents are finding out now that the online option they chose, the academic choices aren't there for the child that are there for some kids who are in person. So maybe they were in a magnet school and those magnet courses are no longer available. So don't be shy. Advocate on behalf of your child and ask questions about what it's going to look like in the school setting, not just around coursework or extracurricular activities, but also around safety related to the coronavirus.
Very good. So here's another question for Anastasia. So let's assume a family elects to send their child back in-person schooling. Mm-hmm. What precautions might schools take to protect students from the risk of COVID-19 when doing routine diabetes care in the classroom or in the school nurse's office?
That's an excellent question. So I think the first thing is that schools really needed to, for those that have already opened, prepare in advance. For those that are doing sort of a soft opening with online initially, they need to get a plan in place and do a practice run of what that's going to look like. This includes everything from, are we going to have 2 clinics? One where we send children who have symptoms of anything that might be infectious, and a separate one where we have children with diabetes go, but also asthma for inhaler treatments or ADHD medication, right? We got to keep those things separate. We cannot work in the way we did in the past in the school setting. That's just not, it's just not, just usual business in the schools. Schools need to work on infection control, so cleaning frequently touched surfaces. They need to make sure that there's PPE available for staff. Physical distancing in the classroom, on the school bus. And again, this question, Jeff, I think you're speaking specifically to how do we manage diabetes. we need to think about alternative options. Can we do things in the classroom, in that cohort where that child is, and not have them walking through hallways where they may risk exposure, or again in the school nurse's office? I think we need to be creative about using technology. Continuous glucose monitoring can be done remotely by the school nurse or the health aide. So these are things we need to think about. And if a child needs their supplies, how are we going to get those supplies to that child? Again, to continue to minimize that risk of exposure. So these are all things that parents want to talk to schools about, and schools should be planning for in advance of that reopening. And again, mask wearing and hand hygiene, training everybody.
Yeah, I'm just going to chime in and just say, Anastasia, you're absolutely right. Certainly the schools want to adhere to CDC guidelines and then some. But I really encourage parents to talk to your local boards of education and find out the plan exactly and ask those questions. Don't, as Anastasia suggested, don't be shy. Ask those important questions and get down to the nitty gritty. Everything from mask wearing to sharing keyboards in the classroom, or sharing musical instruments, and all those things that we don't normally think about during the course of the day that are passed from student to student. So we really want to know what's going to happen. I mean, are the kids going to have to still share keyboards? Are they going to be disinfected in between? How is all that going to be handled? So certainly a lot of good questions, a lot of homework for you families and parents to do between now and the time your kids go back to school.
Yeah.
So we have a very interesting question here from Laura. And she says, thanks for this meeting. I live with type 1 diabetes and am a teacher. My school district has denied me a reasonable accommodation to teach remotely, even though they offer remote learning for our students. I will be required to teach in a room with 30 students and being told that 6-foot distancing will be maintained. Is there anything I can do other than return to work as they see fit or quit? That's a really good question.
It is a good question. It is a good question. Unfortunately, it doesn't have a great answer. There is Family Medical Leave Act availability, and then also with the CARES Act, there's some leeway there. But once that's expended, there's really, unfortunately, not a lot one can do. Unfortunately, it's not the answer any of us want to hear. But I do encourage you to go on the ADA's website, and we have a whole section. Employment discrimination, honestly, is not my expertise, but we do have a wealth of information and resources about employees with diabetes and their rights and legal protection. So please go take a look at that.
Yeah, Laura, and I'm going to put my name and email address in the chat, because this is a topic that I think some friends that we both know who deal with employment discrimination for people living with diabetes would be very interested in learning more about. Not that there is a specific answer, but if this is becoming a broader challenge throughout the economy, people living with health conditions being told they have to go to work in an environment that they may not feel safe in, what do we do? What are better solutions?
I'm Director of
Oh, wow, I am sorry.
American Diabetes Association.
Yeah.
Sorry about that. I was trying to copy and paste a helpful link.
Okay.
I just want to put an exclamation point on exploring opportunities for FMLA, and also the additional sick leave that is available under the CARES Act, which is paid for by federal funding. I know that we have a number of employees here who have taken advantage of that. And I would also talk to colleagues in your district about the potential for advocacy.
Excellent. All right, so here's another question that kind of gets to the medical anxieties that a lot of families would have. If I have a child with diabetes and they get exposed to coronavirus and come down with COVID-19, does this increase their risk for DKA or other adverse diabetes outcomes?
So it's a really, really important question, Jeff. And I think that we all know who have children with type 1 diabetes or work with families who have children with type 1 diabetes. Anytime there is a viral illness, there is an increased risk for hyperglycemia or high blood sugars. and for diabetic ketoacidosis. So the key things here are to have really strong eyes on your child. Does your child have any symptoms? COVID specifically in kids, we see the typical symptoms of fever and shortness of breath and cough, but we also see abdominal symptoms like diarrhea and stomach pain. So key things, know what your child's sick day management plan is. Be very clear on that. Make sure you have the contact information for your clinic. So if you need help, you can call, and don't avoid seeking medical care when you need it. What we saw very early on in the pandemic was people were very frightened to come in for care, and so didn't seek care until their child was very ill. We are part of a national surveillance study here at the University of Florida. There's dozens and dozens of clinics involved. And really what we've seen in children is the symptoms of COVID-19 in these kids have been fairly mild, much like it is with other children. And we're also seeing that in some of the data that are emerging. But again, any viral illness increases risk for high blood sugar levels. And if those aren't managed carefully, then we can see a higher risk for diabetic ketoacidosis. I would also say that this virus has an inflammatory component. You've been hearing about that on the news, and it's also been linked, and so have other coronaviruses like SARS, sudden acute respiratory syndrome. Those have been linked to hyperglycemia. So your levels of high sugars might be even higher than you might see in a different viral illness. Manage them carefully. Stick to your diabetes sick day care plan and call for help. Talk to a diabetes educator. And if you're concerned, talk to the doctor about whether or not you should come in.
So that brings up the importance of reviewing sick day practices, period, which is something we encourage families to do as they go back to school, knowing that in a non-COVID world, they get exposed to all kinds of stuff anyway. Yes. So let me ask that sort of a follow-up to that. A lot of families, a lot of kids use insulin pumps. Mm-hmm. And would you advise making sure that families get prescriptions for, say, pens or syringe and vial to do injections when they find unexpected high blood sugars or responding to things like elevated blood sugars because of viral illnesses?
Absolutely. So I actually wrote a paper about ketone monitoring. Now, many people find ketone monitoring a very boring topic, but I am a huge proponent of ketone monitoring. Remember, this virus has abdominal symptoms. What else has abdominal symptoms? Ketones. Anytime you're sick, anytime glucose levels are elevated, different clinics have different standards. Ours is, if you're on a pump and you're over 250 twice, you should be monitoring for ketones. If you have ketones and you're using an insulin pump, we cannot rule out that pump site as the cause of those ketones and those high sugar levels. You should always have a backup in place. And if you don't know whether or not it's a pump site, you can't see underneath it. When in doubt, change it out. We're going to change out that pump site and give a manual injection of insulin. Your doctor or your clinic will have specific instructions, but some key things. If you're sick or suspect you're sick, monitor glucose levels more frequently. CGM are best. We actually have a lot of free CGM floating around right now, so ask if that's available to you through grant funding at your clinic. So monitor via CGM. If you doubt the CGM, back it up with the blood glucose meter. If glucose levels are persistently high, over 250 twice in a row, check for ketones. If ketones are detected, call your clinic, right? And have backup insulin on board. That can be pens with pen needles, or it can be syringes if you need to draw it out of a vial, but you need to have a backup plan in place for illness. So
I just want to chime in on that and say that that backup plan should be clearly delineated in the child's diabetes medical management plan. So there's no doubt that there should be insulin and syringe or insulin pen in the school clinic at a minimum. Also, your question about insulin pumps, Jeff, just kind of jarred my memory about another question that I got from a parent, which was the problem was the school was going to require, in the event of a pump site failure, the school was going to require the parent to come and take the child physically to the car or take the child home in order to change out that pump site. So these are some of the things we're hearing. They're kind of one-offers, but I think it's interesting. But so certainly it all goes back to the 504 and making sure that a provision is included that a parent can come into school. Now, maybe the parent has to go through all the protocols of entry and the temperature checks or whatever the school has in place. But certainly the parent needs to have the ability to come to school to provide, urgent care for the child, especially in the event of a pump failure or, CGM site comes out, that parent should be allowed to come into the clinic.
So that brings up some interesting questions. Does the ADA or Safe at School program have suggestions for COVID-19 related provisions to be added to a 504 plan for kids who are going in person and for kids who are doing virtual learning?
The ADA certainly does, and I put the URL up in the chat box. And we've already talked about some of those provisions, but certainly even this year in the era of COVID-19, we still want to include all the basic diabetes provisions for taking academic tests and avoiding penalties for extra absences, and students be able to provide their own self-care and trained personnel going on extracurricular activities and school-sponsored events. But in addition to all of those provisions, there are some COVID-19 provisions for in-school learning. The one in which, is at the top of my list, it should be a provision that the school be required to notify the parent in the event there is a COVID-19 or other infectious disease diagnosis of student or staff. Under HIPAA, the disclosure of that identity of the student or staff doesn't have to be made, but the parent of the child with diabetes should be notified immediately. In addition, kids should be able to participate in extracurricular activities. We've heard of kids who, not just because they're virtual learning, but because they have diabetes and it's, COVID-19, and schools have the perception that kids with type 1 diabetes are at higher risk for contracting COVID-19. Some schools are telling kids they can't participate in those extracurricular activities. So just know that some special attention needs to be paid to that provision in the 504 plan. And again, going one step further, not only is the child entitled to participate, but care has to be provided during those school-sponsored events. And certainly, we want to include the provisions as in accordance with CDC guidance about social distancing and mandatory, not optional, but mandatory facial coverings or masks, not sharing tools or instruments, keyboards, small size classes, prohibiting the congregation of students and staff in social areas. So all of that guidance that CDC has given us should go into those 504 plans.
Very good. This reminded me of something that happened during our virtual Friends for Life Orlando conference, where for our youth programming, we required the kids of all ages to attend using the computer, and the camera had to be on. And we did that as a safety. And it turned out there were a couple of kids, teens and tweens, who were having low blood sugars. It happens. And they were eating food to raise their blood sugars, but they felt awkward eating on camera. So they turned off their camera. And our staff didn't quite know what was going on. We were able to figure it out, and it wasn't a problem. But when you think about COVID-specific sort of accommodations for virtual learning, that might be something parents could write in, that in the event that we are doing diabetes care during a lesson, we have the right to turn off the camera, even if that's something that we would normally not be allowed to do. Just putting that out there because it came up.
I think that's an excellent recommendation, Jeff. I hadn't actually thought of that, and that has not come up. But, to me, it's a little bit like taking the mask off to treat a low. I mean, certainly, to me, it's a no-brainer. You need to treat your diabetes, take care of your diabetes. You want to do it in privacy. Kids are entitled to privacy. They should be allowed to turn the camera off without penalty. I think that's an excellent suggestion.
Yeah.
I would just add in, I think that's an excellent insight from the conference, and that's what's great about the conference is now we can carry that over into the school, the school setting. I would also say for kids who are in districts where all learning is remote, some of our children, the school nurse plays a pivotal role in their diabetes care. And I think some families may talk to the school about check-ins with that school nurse every couple of weeks to make sure that diabetes care is happening and the child has the support they need. Because again, all families are different, have different levels of support at home. And this is really essential that kids who need a little bit more support with diabetes get it when they're in that online only environment.
Very good. So do you see school nurses and other school health aides taking an active part in virtual learning?
I think at the request of parents, absolutely, to the point that parents feel that it's needed. Or, I don't know, let's say there's a slippage in grades or participation. That might be a reason for a nurse to more frequently have these telehealth visits with the student and the parent.
Kind of a one-on-one nurse and the family.
A one-on-one, absolutely.
Yep.
Yeah.
We're doing a telehealth project here because, you know, we've got parents at work and kids at home and we're in the clinic. Let's say the kid has ketones. This is a reality, right? During the pandemic, people are in different places, but we can all join up by Zoom, just like we are now, and actually solve that diabetes question in partnership with the family. And that's really important, I think.
Very good. So some more questions that we've sort of seen coming in. Does COVID-19 trigger diabetes or cause autoimmunity? There was a famous N of 1
Yes.
publication.
Yeah, so many of you have heard of the TEDdy study. It stands for the Environmental Determinants of Diabetes in the Young. And this is a study in 4 countries, 400,000 infants, neonates, newborns were screened, 8,000 children recruited to this trial. I'm going to get to your question, Jeff.
Okay.
Part of the goal of this study, funded by the National Institutes of Health, the German government, the JDRF, many other large diabetes agencies, the goal was to answer a question about, do viruses trigger type 1 diabetes? And then specifically in this study, they were looking at enteroviruses. It's inconclusive is the bottom line. We don't know yet, and this study is about 16, 17 years in. Immunity, autoimmunity, and triggers for type 1 diabetes are very complex science. In a rush to get information out to the public, we have seen the title of recently published manuscripts in the scientific literature that say things like type 1 diabetes triggered by COVID-19. And then when you read the actual manuscript, it's a case study of a 29-year-old who was positive for COVID and had subsequently type 1 diabetes. Remember, correlation, things associated with each other don't mean causality. Just because somebody had both doesn't mean one was caused by the other. I think we need to be very careful about making big statements about what causes type 1 diabetes. And certainly before we can say that COVID-19 causes type 1 diabetes, we need to do a lot more research. And I think if you read carefully in every single manuscript that is titled that way or leads you to believe that may be the case, what they say at the very last sentence is a lot more research is required before we make that assertion. So trust but verify. So read carefully, read the literature yourself. If there's a lot of fancy statistics, talk to your diabetes care team so they can go over those with you and really tell you what the meaning of that journal article is in the end.
Perhaps a bit of a rush to publication.
Yes.
All right, so here's sort of a general question for families who may be going back to school for the first time having a child with type 1 diabetes. Who do they contact to write a 504 plan?
Parents should contact the 504 coordinator or the person at school who's responsible for 504 coordination, whose title may or may not be 504 coordinator. So the parent should contact the 504 coordinator. That could be a principal, it could be a guidance counselor, it could be a teacher, it could be someone else. So that's the key. And I also recommend for that outreach, certainly make a phone call, but always, always, always put everything in writing. You want to document, because sometimes things move slowly or not as quickly as we would like. So it's always important to document all requests and put all conversations or confirm all conversations in writing.
So that actually brings up sort of a second question, which we see actually quite frequently. If everything's going well at school and my child's receiving their care accordance with their diabetes medical management plan, do you need a 504?
Absolutely, a 504 is needed. The time to write a 504 is the ideal time to write a 504, I should say, is when everything is going well. We don't know what's going to happen tomorrow. We don't know if we're going to have that wonderful teacher who has a child herself with type 1 diabetes. We don't know if we're going to have that supportive school or supportive principal. So my recommendation has always been to be proactive rather than reactive. Don't wait for a problem to occur and then sit down to write the plan. That's not the best time. Let's put it in writing while everything is going well. And the best time to write a 504 plan is either the very beginning of a school year or right before the beginning of the school year, or when the newly diagnosed child returns to school. And I should provide a little bit more information to say, Section 504 is a federal anti-discrimination law. Unfortunately, some of the regulations around Section 504 are somewhat ambiguous and unclear. And what I mean by that, the regulations do not provide definite timelines. And what that means for the parent is the parent may need to be a little persistent in making sure that 504 team is pulled together in a timely manner, I would say within a couple weeks. And then the 504 plan is generated out of that team meeting shortly thereafter. So keep track of all those deadlines, all the dates. The parent may have to be the driver of keeping things moving, but definitely request that 504 plan while everything's going well.
Jeff, can I just add college students?
Yeah.
If you get large ketones the morning of a test and miss it, or have a really low glucose level during an exam, if you haven't put those accommodations in place before that exam, there's no obligation of the professor to say, okay, well, you can redo it. So college students, visit your student services office or your disabilities resource center and get those accommodations in place in advance. Again, just like Crystal said, the best time to do it is when there's no problem, right? Before you run into something.
And I think that brings up an important point. A 504 plan is not a document that should be filled with tension or antagonism. It's a cooperative plan for the family and the school to ensure that everything happens well. So,
Jeff, I have a personal anecdote. My daughter, when she was in high school, kind of ran the 504 meetings at the end, and her school was great. They had one every year. But in high school, you have 6 different teachers every year. And we had our 504 meeting. It was a couple weeks into the school year, and she was wearing, a CGM and a pump, and they could see the CGM. It was on her arm, and the biology teacher said, I've always wanted to ask what that did, but I didn't want to violate your privacy. And then we had this whole conversation about automated insulin delivery and the state of the science. And people talked about family members they had with diabetes. And it was this really wonderful learning moment. And so it's not, we hear 504 and civil rights and we think, oh, it's going to be tense. It's not. Her teachers were thrilled to have a kid who was comfortable enough to share. It's a learning environment. They felt more educated, and hopefully the kid who came after her, they were in the know, so I have to agree with that statement you made, is that it's an opportunity to really partner with the school. It's not always that easy, but it can be. And I think going in with that approach is a really great way to start.
And also when there is a problem or a concern, it's education, really. That's usually all it takes to resolve the problem. There's, a lack of knowledge about diabetes or lack of knowledge about the school's legal obligation under federal law. So really, truly, it is mainly a matter of education. And 504 is an excellent vehicle to educate school staff. So yeah.
So Anastasia, you had talked about kids in college, and I just wanted to put a plug in for a group called the College Diabetes Network. If you have a child in college or one who will be going, it's an incredibly good resource. It's in a lot of schools across the country. I don't know how many right now, but families can look that up. And at the very least, college kids with type 1 diabetes can find peers who can help them navigate a particular school or find out where the nearest 24-hour pharmacy is, those types of things, if there's any questions. So I always like to kind of toss that out there.
No time like now. There's a lot of isolation on college campuses.
Yeah.
We're seeing. And if you don't have a chapter at your college, start one. Find a faculty advisor and be the change at your college, because you will support other students there and you might make some lifelong friends.
Yeah.
Sorry to jump in.
No, absolutely. So here's another question. I think it's kind of for both of you. Can schools exclude students with diabetes from extracurricular activities because they have a perception that kids with diabetes are at higher risk for severe illness from COVID?
Absolutely not. I mean, and I think we've already covered that, but schools cannot discriminate against students on the basis of a disability, and diabetes is a disability. And schools have legal obligations not only not to exclude, but they have an obligation to provide needed diabetes care and management during those extracurricular activities and those other school-sponsored events. So just be sure to write that into your child's 504 plan, that your child will have full participation and access to extracurricular and other school-sponsored activities, and that diabetes care will be provided as prescribed by the individualized diabetes medical management plan.
Very good. So here's sort of a sideways question, I guess. The COVID shutdowns have caused economic impact throughout a large part of the country. Have you, Crystal or Anastasia, from your sort of national perspective, seen school districts having to cut back on services as a result of those economic impacts? And if so, does that have ramifications for kids with diabetes and other healthcare needs in those school districts?
I actually have not seen it, hasn't been my experience, at least here in Maryland. And honestly, I'm not clearly aware of what's going on in other parts in terms of that issue. But I haven't seen it, but I would say that if staff and school nurses and teachers and support staff were cut back, that it would have a detrimental impact on children with diabetes, and all children, whether children with chronic illness or children without any kind of chronic illness. Certainly the reduction of staff. So I really hope that's not happening. I know it is, but I hope that it's not, because it will have an adverse impact on all children.
Well, I would say, Jeff, I would only add, to date, I think it's been sort of the opposite. I think schools have really stepped into a public health role and really worked to reduce food insecurity. Over the summer, I'm sure districts across the country provided breakfast and lunch for children, but the kids had to be able to get to school to receive it. Some sent out EBT cards with funding, but schools are going to have increased costs and maybe lower tax bases as things go forward with the changes in the economy. And so we need to make sure that they are able to continue to perform those functions, again, for our most vulnerable children. Yeah,
very, very much so. Once again, for the people listening in, if you have questions or comments, please put them in the chat or the Q&A. Otherwise, I'm going to keep driving this bus here. So here's a sort of a health question. What school services, by the way, I think we kind of touched on this, what school health services can be provided by nurses to students who are doing distance learning? Have you seen specific programs put in place where the nurses are proactively reaching out to, say, the families with type 1 in the community, group meetings or something like that? We talked about the occasional, maybe there's a need, but have you seen anything, an example that we might be able to cite?
Anastasia, I have not, but you're closer to the school nurses during the summer, so.
Yeah, I think this is, I think schools have been made every effort to be as proactive as possible, to really, you know, again, to identify kids who that they need the diabetes medical management plan in place, to try and be proactive about getting that on hand. The school board in Tallahassee, Florida, passed a telehealth direct to school and home. That project we talked about here, that's also happening in this part of Florida. We have very generous telehealth provisions, and I think this is going to increase nationally. We've seen this real change in healthcare where we're utilizing telehealth. And what I like about telehealth, particularly in this context, is that it allows us to include, with safe social or physical distancing, we can include, let's say the family, there are two households, mom and dad live separately, or divorced parents. We can include mom and dad in the same Zoom call, even though they're in different locations, the child, the school nurse. Maybe if there's only a staff member at the school, we can include the district nurse in that call, and the teacher or guidance counselor. They can all be in different places in different rooms. So I think this model of telehealth is evolving. It's very new, but I think moving forward, one day when this is all behind us, I think it's a great way to improve communication, because it's hard to drive somewhere and be there physically for every single child in the schools with diabetes, but we can do it much more efficiently with telehealth. So I think finding a benefit out of a sorrow.
And also, Anastasia, I mean, doesn't it make it for more fluid communication between the school nurse and the provider?
Yes.
Yes. Yes.
Huge.
So
sometimes, you know, in the clinic setting, I remember coming to clinic with my daughter. Sometimes I come with her now, but sometimes she goes on her own. But sometimes you're stressed out in a clinic visit. You're thinking about this or that. You got your list of questions. And then maybe now that I'm on the side as a nurse practitioner, I'll talk to the school nurse, but sometimes the parent and the school nurse hear different things. Wouldn't it be nice just to jump on a call like this and make sure we're all on the same page? Awesome.
Yeah.
And I may even think about the instances where maybe the diabetes medical management plan isn't forthcoming, and an instance where the parent and the school nurse and the provider could all jump on the phone and say, okay, what's up? You know, where's the DMMP? Or we need to clarify this in the DMMP. Rather than, you know, face-to-face is so much better than playing phone tag or emailing back and forth. So,
Yeah, face-to-face has taken on a new meaning when we're all living on Zoom.
yes.
So Anastasia, since you are seeing families in clinic, have you, or could you kind of share with us sort of the general sense that you're getting from these families? Do you see an eagerness to return to in-person? Do you see anxiety by parents? And is it different in kids? Are high school kids, for example, more eager to go back than maybe younger kids? Or, I mean, tell us that sense of the pulse of the community.
I think it runs the spectrum. I think you have every scenario you just described exists in our clinical setting. I think every child is different, every family is different, every school's, frankly, ability to provide, I guess, a safe environment is frankly different, depending on what percentage of children are attending in person and what physical capacity they have. We have really encouraged families to think about the needs of their child, not just the physical needs, but the psychosocial needs, their mental health care. We need to think about families' economic demands. Unfortunately, this is a reality, right? We have single parents who are the sole earner for families. So really what we've advised people is to really think about your own situation. We have open ears and open hearts, and we're really talking through those decisions one at a time with families in clinic. But we could have two 16-year-olds, and one is like thrilled to do online school because they can get their work done in 2 hours, and then they got the rest of the day to skateboard or game. And then we got another one that if they're separated from their friends for one more day, they desperately want to get back. And so it's really across the board, and we're just trying to meet people where they are and keep everybody safe. That's really our goal.
I just want to chime in to say I'm just a little surprised that we haven't heard from, really, we haven't heard from any families who have made a choice to return their child to virtual learning. We haven't heard of any kind of barrier or objection being put up by the school to virtual learning. But we have heard from families whose schools are insisting that their child with diabetes be a virtual learner, which really, really surprised me. So of course, again, the decision is the parent's decision in consultation with the child's provider, and whatever is going on in that community in terms of positivity rates and the school's ability to keep the kids safe, what precautions are being taken. So it's really an individual decision, but certainly there shouldn't be a blanket policy in any school district telling a child with diabetes or any chronic illness they can't come back to school.
So if a parent is faced with that mandate from their school, I'm going to presume that there is no legal basis for that, and that's something they should fight if they are interested in their child returning.
Absolutely. Yeah. But I expected to hear the opposite. I expected the fight to be for the kids to engage in virtual learning, but it hasn't been. We haven't heard that at all.
Very interesting.
Mm-hmm.
We've got about 5 or 6 minutes left, so just a couple broad brush kind of questions here. What else can parents do to make sure their child with diabetes is well prepared to return to school during the time of COVID? Thinking like actually going back in person. Any high-level thoughts, suggestions, other than like get a lot of face masks?
Yeah, I was just going to say, just exercise those precautions in accordance with CDC guidance, and don't wait until the day before school starts to start talking to your children. I mean, this should have been going on, since March and during the summer. So just providing that support, being a role model for your children. Mm-hmm. We parents, we need to wear the mask too and practice social distancing. And so I think really that's the best thing that we can do on all levels, is just to be that good role model for our kids.
And I would just add, and those are excellent points, Crystal, I would just add in all humility, this is a new novel coronavirus. There is so much we don't know. So for those of you who are here today, you've got your ear to the ground, you're listening, pay attention both locally and nationally to guidance. What there may be new or changed guidance as we learn more about the course of this disease. And so, stay engaged in information seeking, again, both locally in your community, but also nationally in terms of CDC guidance. And I think that will stand you in good stead.
And maintain an open mind.
Mm-hmm.
We can't, as parents, we can't go in with all of these specific narrow demands. I mean, it's a new age, and we're all learning as we go along. So we all need to maintain an open mind. Very
good. Where can parents obtain more information about legal protections for children with diabetes and putting a 504 in place? I presume ADA has great resources, UF does. There are resources like that on the Children with Diabetes website. But do you have any sort of specific guidelines that either of you could paste them in the chat, and we'll make sure that those links are included in the write-up and recording of this Screenside chat.
Yeah, with the coronavirus, the Safe at School coronavirus link that I posted early on in the session contains also links to studies, policy, CDC guidance, United States Department of Education guidance, just a wealth of information on that page. So I would encourage everybody to take a look at that.
Excellent.
Agree. And Jeff, I'm just going to add the CDC recently posted some specific guidelines on sort of what environments in schools they consider lowest risk and highest risk. And I'm going to go ahead and add that to the chat so parents can review that for themselves, and that will help with their decision making.
So that actually does bring up an interesting kind of point as we kind of wind this down. Are there specific activities or things that happen, say, in a high school or in an elementary school, in an in-person learning environment, that you would want to be more cautious about? Not necessarily not participate in, but be more cautious about. And I'm thinking like a basketball game in high school where everything's indoors and it's really hard to keep distance. Very different than a football game that's outside where you can be out in the fresh air.
Yeah, the link I put in the chat is great because I think it really summarizes some of this nicely. So at the lowest risk end, we have students and teachers in virtual only classes, activities, and events. At the highest risk end, we have people mixing freely between classes and activities, sharing objects, indoors for long periods of time without masks. If any of this is happening, if there's irregular cleaning and disinfection. So I think you need to think about each activity and then where it falls in that category. So is there a lot of close exposure where, you know, droplets could be exchanged or a long time in a room? So these are all things to consider. And again, it's very, I think, like you said, Jeff, specific to that activity.
Yeah, you know, I'm thinking about assemblies.
Mm-hmm.
You know, kids have assemblies in the gym. That might be something that we aren't doing for a while. And even though the playgrounds are outside, I would expect that the playground activities would be limited to a small group rather than having all the first grade classes come out at one time, that it might be a small group who comes out to use the playground you know, for 10 or 15 minutes. And then the next group. And the other thought I have is the cafeteria, the school cafeteria. I expect that most students will be bringing their own lunch, number one. And number two, eating in their classrooms with their small group of classmates. So that's going to look different.
It'll be grab and go, I think, in many cafeterias.
Yeah, and grab and go, absolutely.
Instead of browse and sit in a group.
Yeah, that might simplify carb counting school lunches. For
Absolutely.
we remember doing with great trepidation years and years ago. So.
Mm-hmm.
Yeah.
All right, well, any closing words? Crystal, final thoughts for families?
Final thoughts. Get your 504 plans in order, no matter the mode of learning that you choose for your child. Check out the ADA's website. There's a wealth of resources out there. A lot of people who have already done your homework for you, so please make good use of those resources. And it's great being here today, and I wish everybody a healthy, safe, and successful school year.
And Anastasia, final words of wisdom?
Yeah, so I think don't be shy about asking questions. Approach your school in a spirit of partnership and talk to the diabetes care team. We are here to help. We're here to answer questions, access those resources that Crystal mentioned that are available on the Children with Diabetes website, and be safe this fall.
Great. Well, I want to thank both Crystal Woodward and Anastasia Albanese-O'Neill for joining us for this Screenside chat. Anastasia is getting ready to get drenched by storms in Florida, and Crystal and I are just taking refuge from extreme heat in the summer. Next week, for those of you who are interested, we have on September 6th, 2 weeks, a Screenside chat on the general topic of language matters. And that's really focusing on how we talk about living with diabetes to help reduce stigma. Real important topic. Hope to see you then. And for those of you who are joining us, thank you very much for spending your Sunday afternoon with us. And I'm going to say goodbye. We'll have a recording of this chat online within a couple of days. Bye-bye, Crystal. Bye-bye, Anastasia. Have a good weekend.
Thank you.
Thanks,
Everybody. Take care. Bye-bye. Stay healthy.